Hi, everyone. This is Paul Peterson from WIS. Very pleased and grateful to have with us today Dr. Rachel Fitz, who works in both the St. Barnabas Hospital and the Newark Beth Israel Hospital. And as a member of their medical team, she's an anesthesiologist. She's been practicing for a number of years now. And we're going to get a chance to get insight from her and what it's like and what she's experiencing on the front line. So I'm very grateful for what she and other medical personnel throughout all of our communities are doing on our behalf. And with that, here's Dr. Fitz. I appreciate you.
Yeah, and thanks for doing this on a Saturday. I mean, there's no days for anybody anymore, I don't think. So
Yeah, yeah.
every day is the
Yeah.
same.
It is. It is. I was just talking about that earlier today too. That it's hard to even place yourself on what time of year it is.
Yeah. So first, thanks for having me, and thank you to WIS, and happy Passover, happy Easter if
Yeah.
you're celebrating at home or however you are over Zoom.
Yeah. Yeah.
But
Exactly. Thank you. Thank
um,
you.
so a normal day for me as an anesthesiologist typically consists of just providing anesthesia for patients undergoing any range of surgical procedures, whether that be elective, emergent, cancer cases, orthopedic, any specialty, as well as for laboring women or part of our acute pain service.
Yeah. And so, what would a normal work day look like for you? Hours and shifts and stuff like that.
So it kind of varies throughout the week. We kind of call it like a seesaw. You'll have an early day and a late day. And a late day, you're then on call, meaning that you're responding to any emergencies that come up in the hospital and have to care for those patients, whether they be critically ill or it's an operative emergency. But typically in the morning, we'll get there around 7 a.m.
Hmm.
And a early day can be anywhere from around 4 o'clock. And then if you're on call, you could be working a straight 24-hour shift.
Oh wow.
Um, so usually like 6 days a week, weekends, holidays, medicine doesn't take a day off.
Yeah.
So,
Right. Right. Yeah. How did you get into medicine? Did you know that's what you wanted to do as a kid, or?
so ever since I was in grade school, really, nobody in my immediate family is in medicine, but my grandfather was a veterinarian.
Oh,
So
interesting.
he was
Yeah.
retired by the time I could really remember, but I always was playing with his like little kits and all of his instruments and things like that. So that was the only exposure I had. And there was no other path for me. I knew it was medicine. I knew I wanted to be a doctor. And I knew, I think probably when I reached college, I knew I wanted to be more hands-on,
Okay.
like some kind of surgical or procedural specialty.
Right.
And anesthesia kind of provides that for me. I get direct patient interaction. What I want to do, I'm immediately affecting that patient and making those critical minute by minute decisions on my own.
Right, interesting. So you kind of knew. That's what I always find fascinating, because a lot of people that I know of that went into the medical profession, and my best friend's actually a dentist, and he was like the only person I knew. We used to walk to school, to elementary school. He would talk about he wanted to be a dentist.
As an elementary school, a dentist.
Yeah, you just do it, and I had no idea. I wanted to be like a baseball player or something like
Yeah.
that. But so he, yeah, and that's what he ended up doing. But yeah, that's interesting. Like there seems to be like a calling early on to a certain extent.
Yeah, there was never any other plan B.
Yeah, interesting. And in your line of work as an anesthesiologist, what is the patient interaction like?
So typically it's very brief. I meet my patient the morning of surgery. I have a quick 10-minute interview with them, asking about their history and other experiences and any complications. And based on that and what type of procedure we're doing, kind of dictates my plan for the anesthetic.
Right.
Um, so And then same thing, whether it's a laboring mother who needs an epidural, they want that fast also. So I'm going in and in
Right,
5 minutes.
right.
And so you kind of have to have that trusting and good interaction with the patient that they will put their life in your hands in just those 5-10 minutes.
Yeah.
So I think that equips us well to deal with these types of emergencies that then pop up in an instant, especially now when family members aren't allowed in the hospital.
Yeah, I could imagine how difficult
Yeah.
that must be in taking on that responsibility. Now, when you were in your training, how did you sort of learn? So you get the technical aspects. I understand all that with the education system, but what about more of the soft skills or more of the patient interaction? And how did you learn to deal with more of the emotional aspects of it?
So I can kind of distinctly remember a few of my mentors and the way they speak to patients. And you just pick up things that you notice that you like, or things really stick out and you're saying, oh, that's like, I don't want to be like that person. And
Yeah,
I feel like also as a younger woman physician, I do feel like I might have a little bit more empathy just because
sure.
early off in my career. But it is kind of something you just have innate. Like you can't really teach bedside manner. It's more of a learned and experiential thing.
Right. So did you learn more from modeling yourself after those that were doing it really well, or did you learn more from I don't want to do it that way, like that person?
I think you remember the ones that stick out that were good.
Yeah,
Um,
yeah, yeah.
and and then you also see things that you're doing and how patients react to it as well.
Okay.
And so I think we all now have kind of a little spiel that we to tell to patients as they're going to sleep. And I say, I'm going to be here with you the whole time and not
Yeah.
to worry. We're going to take good care of you. And all those little things you can say in 10 minutes.
Right, right. That's cool. So what and with the crisis, when did you guys see it coming? Were you I guess, one of the things I think that surprised us all, for the lack of a better word, is to how destructive this virus really is, and how potentially dangerous it is. I think it's interesting because I was actually talking about this earlier today. I remember because I did a lot of flying between, say, January and early March.
Oh,
And I remember almost being like in February, almost mocking those people that were on the plane being overprotective or wearing masks. And I'm like, what the heck? I mean, come on now. And like we were actually goofing on it. And then it started as February kind of wore on, and then early March. I remember I had to go to Miami, and I was like, I brought my own wipes, and I'm wiping
right.
down everything, and in the hotel room, and so it definitely started to kick in a little bit, but I think we're all sort of stunned as to how bad this virus really is.
Yeah.
I know I wasn't as prepared to
I
this.
don't think anybody really anticipated
Yeah,
how deadly and how infectious it was. Um, and I think it probably hit us around the same time. Like we thought we had a few sporadic cases. We're used to the influx of flu and pneumonia kind of in the late winter. But these weren't your typical like elderly or sick patients. And they would come, it would be more frequent. We were not wearing all of the correct protective things because nobody really knew what it was then.
yeah,
We even had a few docs who obviously interact with lots of patients who became sick with a flu, maybe like the second week of March.
okay,
And then it really hit our hospital the weekend of March 21st.
okay,
Up until then, it was kind of like I said, the sporadic cases, undiagnosed, not sure. But ever since that day, our associate chair was on call that day. And he sent out a mass message saying that this is now real. I've had to respond to 8 people so far this morning. We need a specialized team. We need to change the hospital system. We need to cancel cases. We really need to turn this hospital around into a critical care facility.
Okay. And how, yeah, and what did that process look like, and how did that plan get put into action? How did you sort of mobilize that?
So I guess fortunately for us that our associate chair was on for that weekend,
Yeah, right.
he implemented this, what we're calling this airway team of a few specialized physicians that will immediately, that's their only job, is responding to these breathing emergencies, sedating these patients and placing a breathing tube and placing them on the ventilator. The hospital had mandated that all surgeries be canceled, whether it's a threat to life.
Okay.
And every day our ICUs would fill. So we usually have 3 ICUs separate in the hospital. We've now expanded to, I believe, 7.
Okay.
And so it's kind of overwhelming for our critical care intensivists. So as anesthesiologists, that's also within our scope of practice. So we now run 2 of those units. But every day is an adjustment. Our plan is changing every day with the influx of patients, with the allocation of resources. But we've really all come together and have divided up into these separate teams and separate responsibilities for the hospital.
And so what are you doing now? Like, and when did sort of your role change into what you're currently doing? So if you can talk a little bit about what it is that you're doing on a daily basis and how that is different from what you were doing prior to the crisis.
Right. So we've completely shifted our practice from elective operating room, day in, day out procedures. A typical day for us now, everybody is working a 12-hour shift. You're in or you're out, you're day or night. Okay. You're working in the ICU. You're on this special airway team responding to all these emergencies, or you're trying to keep a happy face on the labor and delivery floor. So we've kind of divided up into these little subgroups. We rotate throughout, but there's a definite strain because we feel like we're fighting a losing battle. Every day you go in and it's, you're walking into the hospital to death and dying. It's not happy anymore. But so now the typical day is that 12-hour shift on any one of those services. And we've really rallied together as a team, not only of physicians, but our nurse anesthetists and our critical care nurses, and even any healthcare worker in the hospital has stepped up and is working outside their comfort zone, because we now have, I think this morning, we get updates every 12 hours about the status. I think we have almost 90 vented patients today.
Wow. Oh my Lord.
Yeah.
Wow. And how have you had to change your own mindset?
So not as much. My mindset is different. As in, I said, I'm not going to work to, take out somebody's tonsils or to do a facelift. I'm going in knowing that I am going to be placing patients on a ventilator who have a 50 to 80% chance of not coming off of it.
Wow.
I come home and working the 12-hour shifts, day after day does kind of drag on you because you never really have those early days, or even last night I worked the night shift. So then you kind of come home and try and be happy with your family, but Brian can see it on my face if I've had a bad shift.
Yeah,
Uh, so it's my mindset has changed, but after doing it for like about 3 weeks now, unfortunately, that's our normal
I see.
now, and it's everybody's gotten into the routine of that being our normal. We're not shocked daily anymore.
I see. And how do you, as a team, support one another? Like, what
Uh,
how does that, how does that sort of
yeah,
manifest as like the support of your teammates?
it's really great. We've actually all come together. We have one big chat where we keep sending little updates or journal articles or team photos from the unit that day, and try and keep spirits up. Um, for a lot of us, that's our only other interaction with
Yeah,
people is, when we're in the office or in the ICU, and seeing our friends and colleagues. It's nice to have conversations that are not about this disease,
yeah,
and
yeah.
be interacting with people and asking about, plans and family and kids. Um, and then that's when we'll all eat lunch together, we'll all eat dinner together, and you're really just having each other's back in that emotional sense. But then also on the physical sense, we're used to kind of just running into the fire and dealing with it. But in this kind of pandemic, you have to look out for yourself too.
Yeah,
So we're checking each other, making sure our gowns are tied and tucked in, making sure our masks are fitting correctly. If we're running low on something, we go, oh, I'm going to get one. Do you need anything? We're constantly, even if we're not looking out for ourselves, we're looking out for each other.
that's great.
Yeah.
And I was going to ask you that too, in terms of putting yourself in harm's way, knowing how, especially with your role, being right there, and that threat of becoming infected. There's no one getting as close probably to a patient as you are. And how do you how do you handle that fear, and how do you handle sort of Brian telling you, like, are you sure you should be doing this? And, other family members, how are you dealing with all that?
Yeah. So in terms of the family aspect, as I mentioned before, nobody really else is in medicine and kind of understands what I do every day. So they have that obvious concern. And my mom and mother-in-law text me every day, like, I'm worried about you. So it's nice to know that they're worried about me. But I'm not really scared. Um, I know it's just a matter of if, not when.
Yeah.
And as you mentioned, we are literally staring them right in the face as they're struggling to breathe. Um, so like we really just have to look out for each other, and like I said, make sure we're all dressed and tucked in appropriately.
Yeah.
But it's that, when will I get sick? How bad will I get sick? We already have a few physicians and nurses that are out. But then also, if I'm going to be spreading it before I know I'm sick, if I'm going to be bringing it home to Brian. And thankfully, we're both young, healthy, active, but I'm exposed every day, so it's that
Yeah.
cumulative exposure. But I'm not scared, because I feel like it's my job. I signed up for this dedicated team,
Mhm.
this airway team,
Yep.
and I feel that responsibility. And when I go into work, I don't think about getting sick. I go to work, I do my job, I see the patients in need, and do the best I can.
Well, that's phenomenal. Well, people like you are a gift.
Thanks.
Yeah, thank you for doing that. How do you now take on this role as well, providing comfort, an extension of really to a family that for loved ones that can't be there. It's got to be very lonely for the patient, of course, and very troubling for the support system that wants to be there but can't.
Yeah, so that's probably the toughest part because um, I mean, you'll always remember those few patients that you were the last one there when they passed.
Mm.
Um, but by the time either the emergency room or the ICU has called anesthesia, the patient has already severely decompensated and is already pretty bad. Um, Same thing as before this crisis, I have to talk to them in the quick 10 minutes and reassure them. But this point, it's pretty scary because I'm in head to toe in this big gear. I'm
Yeah.
screaming through my mask. Um, I do my best to let them know I'm just going to give them some medicine. They're going to fall asleep so that we can help them breathe. A lot of times they're thankful because they're just exhausted from spending every minute struggling to get a breath.
Yeah.
Some are texting their family members before they go to sleep. But a lot of them are just very complacent. They're too exhausted to speak, to do anything else. They're relieved. They're just like, thank you. And like they, unfortunately, at that point, they're relieved to not have to put in that much effort just to be breathing.
Great.
Um, so like I said before, we're used to being the last voice that patients hear before they go to sleep and putting them to sleep for procedures. But unfortunately, those few stick out where we are the last voice ever that they've
Yeah.
heard. So that's what the big toll, I think.
Yeah. And just to, not to get too personal about this, but I think that's got to be extremely difficult. I mean, I think death is extremely difficult for all of us to embrace and accept, but how do you deal with that?
Um, so it is. I can still see the few faces of the few that I was right next to them. I deal with it during the moment. Unfortunately, we're accustomed to seeing it, so you kind of debrief with your team. You kind of discuss what you could have done better and all of that, and then unfortunately have to move on to the next one. But at the end of the day, uh, like this one day, I came home and Brian was like, "Are you okay?
Yeah.
What's going on today?" And so he's been a real big support system, and it's actually helpful that he's not in medicine, that I don't have to describe every detail to him. I just say, this happened today. It was bad.
Yeah.
Um, but also lots of wine and ice cream.
Thank God for those. Yeah, yeah,
I think we're on like a delivery service now.
yeah.
But
Yeah,
it's more of that emotional toll. It's not the work hours because we're used to working long shifts and 60 to 80-hour weeks. But it's more that constant losing battle that
yeah.
that brings you down.
No, I can appreciate that. It's interesting how you when you talked about that in the beginning, sort of you feel like you're fighting this losing battle. I didn't think of it in terms of that way, but that aspect and for what you do and in your role, that's got to be such a demotivator to a certain extent, knowing that that's really the game that it's become right now, and how helpless you must feel.
Yeah, it is. So then whenever we hear an inspiring story, like one of my good friends, his mom is a nurse. She was in the ICU. She's being discharged. She was off the ventilator now after 3 weeks, and so you need those winning
Yeah,
stories.
yeah, absolutely.
So
Yeah.
that's what we keep. It is possible. So that's just kind of what we have to keep looking for.
Yeah, hope, just and what have you, I mean, just in looking at sort of these past, 3, 4 weeks, what have you learned the most from all of this? What do you think is probably, I mean, I guess maybe from two perspectives. One, just from a medicine point of view, and more on the technical side, but also then just on a more emotional, spiritual side, how have things like this changed you?
So I think as in terms of learning experience, it's difficult to say because nobody really could anticipate this. But I think we did a good job of stepping up. But I think learning wise, we could have maybe thought a few days ahead instead of just dealing with that day at that time. But it's hard when you're in a crisis to keep thinking forward to what could be worse. Um, we have learned how to be creative with different equipment,
Hmm.
and I do have to commend all of the nurses in the hospital for stepping up and working outside of their comfort zone. We have a limited amount of critical care nurses, and now literally every nurse in the hospital, whether they were taking care of surgical patients, orthopedic patients, whether they were in the operating room helping out with surgeries, everybody is now taking care of these vented patients. So it's been a real learning curve, and us then now having to have that patience and humility to not only do things ourselves, but to repeatedly teach these things to different fields
Yeah.
of healthcare workers.
Yep.
Um, and personally, I have learned that we can step up to kind of any challenge.
Hmm.
Uh, it's very surprising and heartwarming how much my department has really come together and really taken on any challenge and put their own health and well-being aside.
Yeah.
So that's probably the most inspiring is the group as a whole.
Yeah, it's admirable. It
Yeah.
really is, and what you're all doing and having that team, I think definitely is, I think, so important, especially when you're dealing with something like this. Is just having others that you can lean on and seeing how they rise to the occasion too. That's got to be very uplifting.
Yeah.
Just, I guess, if we could even go a little bit further into that, what is sort of the way, and I know this is a day-to-day type of thing, but how are you and your team preparing? Like, how are you looking at this? Is it really just, at this point, day to day, or are there other things looking beyond sort of the 24-hour?
Right. So I would say this past week we've stabilized the massive influx. We now
Yep.
are prepared. We know we're going to have lots of patients every day.
Yep.
Um, so back a few, like especially 3 weeks ago, but up until I think the mid last week, it was day to day. But now looking a few days ahead, we have laid out a plan to expand our units. We actually have been getting staff. My anesthesia practice is a private practice, so it's a national company.
Okay.
So groups that are not yet affected, but their hospitals have slowed down elective things. We have had volunteers from all over the country
Oh, that's incredible.
now coming to our group to
That's great.
help. So we are looking ahead into the weeks to come. Unfortunately, I think a lot of us think it's going to go into May. It's not going to be over by the end of April.
Hmm.
We've laid out plans for the hospital about where the next patients will go.
Hmm.
Uh, and then in terms of the whole hospital as a whole, as I said, every day we get a morning and an evening update on how many patients are in the hospital, how many are on ventilators, how many we have left, how much supplies we have, and unfortunately a daily update of our deaths. So it's a little sobering to see all of those numbers, but it's comforting to know that we are on top of it and thinking forward and keeping track of these things.
So, and how does that look right now in terms of just supply and ventilators? And it was, I think, reassuring to a certain extent to hear that there are other places that are looking to collaborate and help out where there may be more capacity and the will, but there's a willingness to do so. I think is encouraging. But
Mhm.
how does your own supplies look now? Like how and what sort of what do you guys see in terms of additional supplies becoming more available? What's sort of the timeline there?
So we actually just got a donation from, I believe, Tesla
Oh,
that
nice.
donated a bunch of ventilators. Um,
Wow.
oh, I'm sorry, this dog.
No, it's fun. I like it. It's adding real life authenticity to our chat here. Yeah. Keep going.
Um, and we are getting donations from the community of a lot of masks and gowns and gloves and everything. So it's a little scary when you see those numbers start to trickle down, but then the next update they're back up again.
Okay.
So like I said, like last week things were at 0, and then the next update we would have like 200, and then it'd be back down to 0.
Wow.
Now we're kind of hovering in like the thousands range in terms of supplies. And we're utilizing not just dedicated ventilators to help these patients breathe. We're using other machines that are sometimes used for sleep apnea and kind of implementing them in a short-term basis. We have expanded one of our ICUs is now the operating room.
Oh,
So
wow.
an anesthesia machine that, you know, keeps you asleep and helps you breathe during your like
Yep.
general surgery procedure can help you breathe if you're in lung failure. So
Interesting. Yeah.
um, we've taken over those because those are specialized ventilators that typically only anesthesiologists are trained to operate.
Right.
So as of now, we have, I believe, 10 patients on those types of machines, and we have the capability to expand that a lot farther.
Interesting. So when something like that happens, when it's you're I guess to a certain extent you're being creative, you're being innovative because you have to, right? How does that work? I mean, you know, because again, I guess what's interesting, I think, from us from the outside is trying to get a sense of the insight and how decisions are made and how you sort of you know come up with these ideas and then implement these ideas and knowing that will this work, will this not work.
So I think it's kind of weird as anesthesiologists, our job is to help patients breathe. So we're used to kind of like MacGyvering different tubing and like putting oxygen in different, like we're used to troubleshooting and
Yeah.
changing things. And so we thought of a few of these things before this even happened. We didn't think we would need it, but
Yeah.
we were like, hey, we have, you know, like 30 operating rooms with machines that
Right.
can ventilate people. And everyone's like, oh yeah, okay. But now it's, so we're used to it. And
Yeah.
on that group chat, we keep sending different methods and different machines and different kind of ideas. So it's good that we're kind of that tinkering mind.
That's pretty cool. I never, you know what? I never realized as you were saying, I was like, wow, that's pretty interesting how creative actually the anesthesiologist is in terms of what their daily function is, you know, and how they have to think of things like that. But, you know, and you were saying on that group chat, now are you sort of belong to, and I imagine you do, that you're talking to other um, anesthesiologists in different hospitals and facilities?
It's just my practice. So we have
Okay.
about uh 50 plus anesthesiologists. We probably have maybe 30 or more nurse anesthetists. We have a handful of PAs and nurse practitioners, and then of course our administrators and office staff. So everybody's seeing this and is responsible for different parts of it.
Hmm.
Um, and we're at different satellite hospitals within our group. So we're kind of sharing things amongst the other facilities that we're all credentialed at, but
Yeah.
it's just our group.
Right.
And it's kind of passing things on from one shift to the next, one hospital to the next, and
Right.
it's the easiest way to communicate with like the 100 people.
Right. Good. So what would you advise us, starting just with how we should be looking at COVID-19, and what advice you have for us in terms of, you know, remaining healthy? It's any advice you have, really.
So I think we've been doing good with the social distancing and all of that. But just basically be smart. Don't don't let it lapse. Anybody can get it. Um, it's not just you. You might have like a little cold, but you don't know who you're passing it on to. Um, if you're young, old, sick, healthy, rich, poor, it doesn't matter. It's anybody. But it's tough for me because I don't watch the news anymore. They're
Yeah.
not telling me anything I don't know. So just take care and do things that make sense, like
Yeah.
washing your hands and staying away. If you're going to wear a mask and gloves to go out, make sure you know how to wear it and how to take them on and off and what to touch and what not to touch.
What is the proper way? Just if you don't mind, I think that may be helpful
So the
for
big
all of
thing
us
with
who have
people,
no idea what we're doing. Yeah.
a lot of our nurses have actually posted YouTube
Okay.
videos about how
Yeah, yeah,
to
no, that's
properly
good to know. Well,
do it.
I'll make sure we reference that. Yeah.
But the big thing is like, make sure the mask is covering your mouth and your nose, not just
Gotcha.
one of them.
Yeah, yeah, I've seen all kinds of ways people
Yeah,
are wearing these
they
masks.
have 2 straps. Both straps have to be on. Um, don't be touching your phone and touching groceries and then adjusting your mask and adjusting your face. The
Okay.
big thing with telling people to wear masks is that they're uncomfortable and you will touch your face more.
Interesting.
So you have to be even more cognizant of it, of not touching and adjusting and moving and all of that.
I say.
And the gloves are my favorite part, where they're opening their car door, they're texting on their phone, they're grabbing everything, they're touching their keys, their wallet, and then they're taking them off before they touch the doorknob to go in their front door.
I say.
Like you might as well not warn them.
Yeah, right, right. Now, what about you, like in your home deliveries, right? So just so that it gets, do you, what do you do there? Is there, because I've heard and seen all kinds of different things you're doing.
um, if it's in like a brown box, I open the box and throw it out right away. We actually just went grocery shopping yesterday. We hadn't gone in over 3 weeks. So just from seeing the mass of people at the supermarket, and like, don't trust anybody.
Yeah.
Everybody is sick. Everybody is a carrier. That's what we're even assuming at the hospital. If I walk into the hospital and I'm perfectly healthy, it doesn't matter. You have it. Like,
Yeah.
just think everybody has it. You don't have to go nuts, but you know, I wiped down the obvious things and
Yeah. Yeah.
do the best you can. I mean, there's people who take it to an extreme, but just be smart and wash your hands when you're done. Don't touch your face.
Which is really hard to do, I'll tell you.
It is.
I find myself so many times afterwards, like, oh God, I did it again. Yeah.
Yep.
Right. So, just in terms of like testing and stuff like that, any information you can share with us as to a timeline as to when maybe more testing will be out there, and sort of, I guess if you, again, and I'm just asking you if, from someone who has a lot more wisdom than we do, how long do you think will be sort of under these circumstances?
So in
And
terms
that
of
we should
testing,
mentally prepare for, put it that way.
right, in terms of testing, it's hard to say. Right now, they're really only recommending if you have obvious symptoms, if you don't feel well, which is understanding. I mean, you would do the same for any disease.
Yeah.
Like you're not going to get tested for every disease out there just to know whether you have it or not. And then people are concerned. They're like, well, what if I'm spreading it unknowingly? Well, you shouldn't be going out and doing these things to begin with.
Okay.
So just be smart about that. I think they are ramping up the ability to have tests. I know for at least healthcare workers, if we have a obvious positive exposure without protective equipment and we're really starting not to feel well, we can get kind of priority. But in terms of timeline, so I know they've kind of put the ban on until the end of the month, but I know New York City schools now just shut down for the rest of the year.
Yeah.
I don't know if all of New Jersey public schools have done that yet. But we really think we haven't flattened the curve yet in the hospital.
Okay.
We are still seeing and placing 10 to 20 patients a day on a ventilator.
Oh, wow.
So, and it's mid-April. So I would say through May.
Okay.
Unfortunately, there's no way to really
Yeah.
judge it.
Yeah. I
And we're
think,
hoping this social distance has been going on now for what, three weeks.
yeah.
So, and then when you have the incubation period and all that, so maybe in another week or two, we'll start to see that decline. But as of now, we're still as busy as we were. We don't see a decline yet.
Fine. Okay. Thank you. That's helpful.
Mm-hmm.
And in terms of just real news versus maybe news we hear, or we because I think you said something before, which I think is real important for all of us to understand, that it can hit anyone. I think one of the other sort of preconceived notions or perceptions that we had before really knowing more about this was sort of this more, if you weren't having a compromised immune system to begin with, or if you weren't elderly, that this is something that may not impact you, and that the chances are it won't. And if it does, it's going to be minimal. Has that changed?
So yes and no. I would say it's hard to determine because the people that we're seeing are the sickest of the sick. I'm not seeing everybody who's at home.
Yeah, I understand.
But we are still seeing 20, 30-year-olds on ventilators. We are seeing those elderly and sick patients. We have 70-year-olds who are waking up and doing well, doing better than our 30-year-olds. I think it's all, unfortunately, how your body then attacks the virus and how fast it has that immediate response. And it also has to do now with we're calling it viral load, how much exposure you got, which is why we're concerned for ourselves, is because
you're right there.
We're fully protected. I'm really should be getting little to no exposure, but 20 times a day, every day for 12 hours a day,
You're right there.
it's more than just one person coughing on me at the supermarket.
Yep.
So it's hard to put a strict demographic or subset on it. If you then have other comorbidities and you're not doing well, your mortality rate unfortunately does increase more to that 80% range. But if you're otherwise perfectly healthy and younger, I think it's more in the 40 to 50, which is still significant.
It is.
Yeah.
Yeah, and I think one last thing about this, I think there was also that commentary on it's like the flu, but it's not like the flu.
I think we all thought that.
Yeah.
Because before you could really see it, and before it hit Italy and Europe,
Yeah.
we kind of didn't have a sense of who it was hitting, how fast, how bad, and we're used to seeing these flu surges. I mean, everybody gets it every year, and some people progress to pneumonia. Some people can work through it. We just didn't expect to see the volume, I think.
Yeah. So in terms of for us on the outside, and again, we're very grateful for what you're doing, and please thank you and your team and everything on our behalf. But how can we help? Like, what are ways that we could help support, or ways in which we feel to a certain extent that we're helping you guys do what you're doing every day?
So short term, kind of take care of yourself, help
Mhm.
us help you. The less critical patients we see, the less strain on the healthcare system it will be. Um, if you're sick, call your physician first. You know, take the proper steps. Try not to overwhelm the emergency rooms unless it's critical.
I think that's a good point. When they call, um, emergency help versus like, at what point would someone be like, I have to do this. This is time. I
So
have.
we've all had a cold. We know what it feels like to have like those muscle aches and pains, like a fevers and things like that. But if your fever is significant, if it's not well controlled, if you're having that difficulty breathing, chest pain, that's probably the first indication, because it's dangerous if that progresses farther. And then once your oxygen level starts to drop, if you're starting to get confused, dizzy, things like that, that's how you know your oxygen level is starting to go down. So um, having people around who can notice changes in you is sometimes more helpful than you trying to notice them on your own.
I see.
Um, but in terms of other uh, help, like aside from those short-term things, taking care of yourself and monitoring your loved ones, in the long term, just remember us.
Hmm.
Uh, One day, who knows when, in the next few months, the world will go back to normal. Your life will go back to normal. Our life will never be normal again.
Yeah.
We will always be thinking of this the next time we see any patient with any breathing issues, or the next time the next virus this pops up. We stepped up. We never backed down. So even just thanking us goes
Yeah.
really far. It's really appreciated. I've definitely been called and texted by distant friends and family members I haven't heard from in a while. So just recognizing that they're thinking of you is good. So the next time you go see your doctor in the years
Yeah.
to come, just remember that we're human too, and we're never going to be back to normal.
Yeah, I appreciate that. And if you could, I think if we could almost end there, I would like, just to give you a chance also, just, and I know you're still in the middle of this, but, what change do you think this really has on you, and how this will sort of impact you going forward? What sort of, as you have hopefully some quiet moments here and there to sort of reflect, how is it that you think you'll be changed as a result of this?
Um, so on multiple levels, I think I will be a little bit more cognizant of the resources that I'm using and my day-to-day kind of equipment
Yeah.
and procedural things like that. Acting as if you have the last one. Uh,
Mm.
we're not used to that in this country.
Yeah. So true. So true.
And then kind of on a more personal level, I mean, you kind of go over those things in your head, and it's like, do I have to tell my family my wishes? Should I be asking my parents their wishes? So these are kind of all important things that people don't think of. And then they come to the hospital and it's an emergency, and that's unfortunately not the right time to be having that conversation.
Sure.
Um, but Yeah, I think it sheds a whole new light on the severity and I don't know, the how impactful something so small can be on the whole world.
Yeah, right.
Yeah.
Yeah. Well, thank you so much, Dr. Fitz.
Well, thank
Yeah.
you, Paul, for inviting me.
No, of course. I mean, this has been phenomenal. What you're doing is phenomenal. And again, we're so grateful for what you and your team and every other frontline medical personnel is doing. And that includes everyone in the facility, the cafeteria workers, everybody.
Everybody,
Yeah.
literally.
Yeah.
And thank you to our friends and family at home for keeping us sane and fed and
Right, right. That's right.
and thought of. So that's what it's about. So,
Yeah, thank you.
but all right.
All
Thank you,
right.
Paul.
Thanks so much. Good luck.
Thanks.
Bye-bye.
Bye.
See ya.